My name is Dr. Laura Erickson-Schroth. I'm a psychiatrist and the Chief Medical Officer at the Jed Foundation, a nonprofit that protects emotional health and prevents suicide for our nation's teens and young adults. I'm here to talk with you about substance use disorders. We no longer use terms like addict or alcoholic because that labels people rather than suggesting that substance use is something that can affect anyone. Anyone can develop a substance use disorder because these substances interact with your brain and your body in ways that can lead to addiction or abuse. Substance use disorders are very treatable, and there are different ways to approach substance use depending on the substance you're using and the methods you feel comfortable with. The main thing to look for is when you start to feel like you can't control your use of substances. One way to think about if you have a substance use issue is going through the 3 C's: cravings, control, and consequences. Check in with yourself to see if you have cravings to use the substance, loss of control over your use of the substance, or consequences that come from your use of the substance. Consequences could affect your health, your relationships, or your school or your work performance. If you have one or more of the 3 C's, it suggests you might have a substance use disorder. Any substance that impacts your brain in some way can lead to a substance use disorder. The most common substances people abuse are nicotine and alcohol because they're legal. The next most common is marijuana, which is legal or decriminalized in some states. Substances that more strongly hit our pleasure and reward systems in our brains are more likely to cause addiction. Some examples of substances that are known to be highly addictive include nicotine in vapes or cigarettes, alcohol, opioids like oxycodone or heroin, benzodiazepines like Xanax or Klonopin. It's really hard to predict who will develop a substance use disorder, but there are things that can make it more likely. Experiencing abuse like physical, emotional, or sexual abuse in your childhood. Having problems at school like bullying or feeling isolated. Having ADHD, which can make people more impulsive and more likely to have substance use issues. Living with a mental health condition like depression or anxiety, which can lead to using substances to make yourself feel better. It's hard to say the likelihood of one particular person developing a substance use disorder, but all these factors can play a role. There are different ways to approach substance use depending on the substance you're using and the methods you feel comfortable with. For the most part, you should have the same options for treatment that an adult has. In some states, parental consent is required for certain types of treatment. But in general, you should be able to find treatment that works for you. Here are some treatment options for substance use disorders. A lot of times people use more than one treatment option at once to maximize their chance of recovery. Individual therapy with a counselor or therapist who has experience working with other people with substance use disorders and is comfortable talking to you about substance use. Group therapy with other young people who are going through something similar to you. Family therapy, where you see a therapist specifically trained for working with families who can speak with you about what the issues might be that are contributing in your family to your substance abuse. Self-help groups like AA or Smart Recovery. Groups for teens are often led by adult volunteers. There are also medications that can help reduce cravings for certain substances or minimize withdrawal symptoms. Some states allow you to get these medications without your caregiver's consent. Many parents are likely to give permission because they want you to recover. If you're interested in treatment and think your caregivers may be open to it, talk to them about it. You can be treated for a substance use disorder while living at home, called outpatient treatment, or an inpatient treatment, also called rehab, while working to change your relationship to the substance. Inpatient treatment programs typically last a month or longer, and they can be helpful if you're having trouble staying away from the substance on your own. Whether you go for inpatient or outpatient treatment, you'll probably have a mix of treatment, including individual and group therapy, where you'll work with a counselor and also with other people who are struggling with substance use issues. Some people who go through substance use treatment eventually stop thinking so much about the substance use and it doesn't affect them day to day. For others, even years later, it's important to go to meetings every day or stay in treatment to avoid having a relapse. Many people who've struggled with substance use disorders use words like recovery to describe their experience. While they may have struggled with substance use, they don't see it as defining them as people. If you're looking for help with your substance use disorder and you have an adult in your life who's supportive, that's the best place to start. Friends can be supportive, but adults can better connect you to resources. In addition to parents or caregivers, you might consider reaching out to a teacher, coach, school counselor, or your primary care provider. Once you've identified an adult you trust, find a place that feels comfortable And start off simple. Say something like, "I'm hoping you can help me with my alcohol use," or "I need help with my cocaine use." Ask if they know about local resources like substance use treatment programs or self-help groups. If the two of you are having trouble contacting local resources, you can reach out to the National Helpline at 1-800-662-HELP. The same resources can be found online at findtreatment.gov.